Hi guys, Dr. Matt Tonis from New Life Chiropractic. Behind me on this screen here, you're going to see a chiropractic x-ray of somebody who has the beginning stages of a scoliosis in their spine. So what a scoliosis is where the spine actually bends in an S shape rather than going straight. And why that's a problem is because over the years, as gravity loads down on the body, it creates abnormal spots of pressure in the spine that will ultimately deteriorate, put pressure on the nerve system, and be impactful in the overall longevity and function of both the spine and the nerve system. So from a childhood perspective, many times scoliosis is first evidencing itself in those growth spurt years, especially during adolescence. So starting around the ages of 10 and 12, we will start to see a lot of people developing a scoliosis, and you see it by one shoulder sitting high or a rib cage hunching out on one side of the hips sitting higher than the other. And when you see that happening, that's the indicators that there's a scoliosis forming inside of there. Chiropractic has several strategies to try and help the progression of scoliosis, to try to create spinal stability, to try to reduce neural tension, and to try our very best to limit the progression as much as possible. Periodically, in certain cases, we actually even see the reduction of scoliosis happening in certain cases as well. Scoliosis is one of these things that sometimes has a hereditary component to it, and sometimes it's just called idiopathic, which means we have no idea why it actually formed in the first place. Either way, the most important thing is early detection and good active strategy in terms of trying to make sure that the scoliosis doesn't progress and that the patient is able to keep their spine in as healthy of a way as possible. If you have a family history of scoliosis, or you're suspicious of any of your children or yourself potentially having scoliosis, doing a spinal checkup in our office would be a great strategy to be able to get a baseline measurement on that and to be able to determine the best and most appropriate strategies in terms of managing that scoliosis as best as possible. Both Dr. Barden and myself have hundreds of patients over the years that we have really helped successfully improve the quality of their health, the functioning of their spine, and the outcomes of their life based on properly navigating their scoliosis. We'd be happy to help you if you have any questions.